I saw a picture of myself and I couldn't believe that I was that big. Blue Cross helped me with my weight loss journey by providing me with the resources that I needed to live a healthier lifestyle. There's the Blue 365. They offer affordable gym memberships, and also they have weight management tools on there. I feel much better. I have a long journey ahead of me, but I feel that I've come a long way as well.
Doctors New Orleans is underwritten by Blue Cross and Blue Shield of Louisiana, Winn-Dixie, and New Orleans Living magazine, highlighting the best of our city.
I'm Maria Muro, and welcome to Doctors New Orleans. Tonight our topic is snoring and sinus disorders. Snoring is noisy breathing during sleep. It is a common problem among all ages and both genders, and it affects approximately 90 million American adults. That's 37 million on a regular basis. And when it comes to sinusitis, over 28 million Americans suffer from this disorder as well. My guest tonight is Dr. Akash Anand, a local ENT at GNO Snoring Sinus. That's his private practice. Dr. Anand completed his medical degree at Tulane University School of Medicine, followed by a 4-year residency in otolaryngology, head and neck surgery, also at Tulane. Dr. Anand is uniquely qualified in that he is the only fellowship-trained ear, nose, and throat physician in the region, with an exclusive focus on treating sleep and sinus disorders. He's also a member of the American Academy of Sleep Medicine. Dr. Anand, thank you so much for being on the show tonight.
Thank you for having me. All right.
I know that you've had a very, very busy day.
Yeah.
And you're always seeing many patients, but the fact that you made time to be here with us tonight is fantastic. So thank you again.
Oh, no problem. It's my pleasure.
Well, I want our community to get to know you, Dr.
Sure.
Anand, because you recently went into private practice, correct?
That's correct.
So why don't you tell me about, this transition in your life, and after, working for so many years in your field, you decided to truly go out on your own and develop a practice that focuses on sinus and snoring.
Sure, that's great. So after my residency, I did a fellowship in head and neck cancer up at the Medical University of South Carolina. And after that, I came back to New Orleans. I wanted to come back. I grew up here across the river on the West Bank. I lived down the street from my folks. So I went over to Oxnard. I worked there for a few years. It was a great working relationship. My practice is just naturally focused on sleep and sinus disorders. A lot of patients had it, and nobody was really focusing on it, so I decided to focus on it. And then after doing that, I realized we could do things a little differently, so I went out on my own, again, keeping that focus in mind, and it's been great. There's a definite need for that specialty expertise for that subset of disease, and we've been able to provide that for patients.
I think that's wonderful. And so now let's talk about the type of services that you offer at GNO Snoring.
Great. So GNO Snoring and Sinus, ultimately, it's the minimally invasive office-based treatments for patients with sleep and sinus disorders. Most of these disorders are rooted in an anatomic airway obstruction. When these airway obstructions occur in the nasal passage, it can lead to chronic sinus disease, recurrent sinus disease. When these airway obstructions occur in the back of the throat, at the base of the tongue, or in the voice box, they can contribute to sleep apnea. So we focus on diagnosing them with expertise and then treating them both in the office and in the operating room.
Okay. And now let's talk about your patient base.
Sure.
Is it mostly adults? Do you see children as well? Can you tell me about that?
Great question. So it's mainly adults, but we are seeing a lot of children too, mainly teenagers. They're teenagers, of course, who have sleep problems, are not sleeping very well, or recurrent sinus disease. A lot of these patients have been treated very well with medication, but it just hasn't taken hold. So we do see teenage patients as well as adults, but it mainly focuses around adults.
Well, very well. All right, we have a lot to talk about
Sure.
tonight. I know that Dr. Anand, we posted on our social media today that we were having you on as a guest, and I just want everyone to know that you can call anytime during the show. We keep our phone lines open the entire entire hour. And so we're here to serve you and help you. But also many of them came through, a lot of questions came through Facebook for you, so we have a lot to cover. So I want to start out with the sinuses.
Sure.
Okay, obviously we all have them, but some of us have developed issues when it comes to our sinuses. So let's talk about what is the sinus and go from there.
Great. So the sinuses are within our face. They're actually air-filled cavities that we have, some of them from birth, and then as we, of course, develop, they pneumatize, meaning they grow and fill with air. Ultimately, what can happen is they can become infected. Sometimes you can have allergy, which can cause sinus infections, can cause allergic infections. These can be treated very well with medication, but in some cases you can have unique anatomic dysfunctions, which can, of course, impair drainage. And when you talk about sinus disease, recurrent sinus infections, or chronic sinus infections, it's all about the plumbing. Why is there an impairment to drainage? And that's ultimately where it comes from.
Okay, so who typically would develop sinusitis?
Sinusitis can be developed in patients, of course, that have certain systemic immune deficiencies. They can't mount a proper immune attack or immune response. These are patients that can have chronic sinus disease. You have younger patients with cystic fibrosis, for instance. They have very thick sinus secretions. It's almost like peanut butter. These patients cannot clear their secretions like you and I could.
Okay.
For us, clearing sinus secretions is a silent process, but for some of these other patients, it's not. These are kind of the exceptions. More commonly, patients, of course, that live in certain environments. In New Orleans, in this region, especially post-Katrina, a lot of patients complain of nasal congestion and sinus problems.
And also, you know, when you brought up Katrina, a lot of people developed worse cases of allergy.
Sure.
Okay, so is there a correlation between developing allergies, because a lot of times, I mean, how do we tell the difference if you have a runny nose, for instance, or congestion based on allergies, or is it sinusitis? How do you know the difference?
That's a great question. So ultimately, an allergic reaction is a result of what we call an immunoglobulin response. There's a specific one called IgE. This flares up. So some patients have a specific allergy to certain things in the environment. Allergists are experts at defining what they're allergic to and then treating it. Allergy can involve the mucosa. It's all the pink lining inside the nose and the sinus cavities. Ultimately, allergy and sinus disease are medical diseases by definition.
Okay.
But in certain cases, after medical treatment hasn't been successful, then of course procedures can be involved.
All right, and now there are two types of sinusitis. There's acute and chronic.
That's right. So there's acute sinus disease, which is a sinus infection that most of us will experience at some point in time. Symptoms can include real pain in the cheek region, dental pain, pressure on the face, a runny nose that can have some pus, greenish or yellowish, all that gooky stuff too. They tend to last just for a few weeks. Chronic sinus symptoms, of course, include the same symptoms,
Okay.
but last for greater than 12 weeks at times.
Okay, well, I want to go back to the acute. So, you know, a lot of us, millions of us will get a sinus infection.
Sure.
Do you just let that go, and it'll just go away on its own, or what do you recommend to treat acute sinusitis?
That's a great question. So for most of these, it's a viral process. And as
Okay.
a result of that viral process, you can wait it out. You can do simple things, over-the-counter remedies, cough suppressants, of course, allergy medication, sinus medication. But if symptoms prolong past a week, that's when you want to see a medical professional and possibly seek further medical care, because at that point it can be bacterial and not just a viral problem.
Okay, we have a caller on the line. Good evening. Hi, we have Louie on the line.
Hey, how you doing?
Hi, Louie, how are you?
Hey,
Hey, how you doing? Hey, Doc, I got a question for you. My question is, my nasal passages are one or the other are always stopped up. This is constant. This is chronic. And I was wondering why.
that's a great question, Louis. So ultimately what he's describing is nasal congestion on the left and or right side, and it cycles. This is actually called the nasal cycle.
Okay.
It's a very natural process. There's these processes in our nose called turbinates. They'll enlarge from time to time to humidify all the cold, dry air out there. And if Mother Nature inflamed both of them at the same time, we'd be blocked. So what she does is she cycles them. One enlarges and the other drops. And it can last for anywhere from 30 to 40 minutes.
Okay, and thank you for that call, Louie. And also, doctor, so what are the types of symptoms that, we'll see if someone is developing chronic sinusitis?
So chronic sinusitis is a longer term, of course. Facial pain and pressure tends to be the #1 complaint for most people. They just feel that they have a pain in their cheek region, in their dental region as well, that just doesn't go away. A lot of them complain of a orbital headache too, and if you can understand, the sinuses are up here, your frontal sinus, you have your maxillary sinuses in your cheeks, then you have ethmoid sinuses here. So when patients point in this distribution, they're really pointing to kind of the confluence of all the sinuses and where they drain. So the facial pain and pressure is really the hallmark symptom of a chronic sinus problem.
Well, you know, doctor, it's funny because I just learned this evening chatting with you about the dental pain, because
Sure.
a lot of times I think, you know, I feel that maybe I was grinding my teeth, but then I feel like it's really high up here.
Yeah.
And so I just learned something very important. So it's definitely not a dental problem. It's really could be the pressure from the sinusitis.
Exactly.
Okay, so now I want to get to diagnosis. So someone comes to see you, they've been suffering with sinusitis, they're tired of not feeling well, not breathing well. They come to your office, and where do we go from there?
So when they come to the office, we have a discussion, much like we're doing today. We talk to them, we ask them about their symptoms. It's a clinical diagnosis for the most part. What we will always do with every patient, if it's been past a week and it just hasn't gone away, or there's a pattern of disease process over the past few months, we'll do what we call the nasal endoscopy.
Okay.
This allows us to take it one step further. With a nasal endoscopy, we actually insert a camera into the nasal passage and we look right at the problem. We look at the source. Because a lot of times these patients that have come to see us, they've been treated very well by other physicians, so we have to take it a step further. And in doing so, a lot of times we can find natural anatomic obstructions that are causing the recurrent nature or chronic nature of their problems.
And do you have any in-office treatments that can help someone? Or?
Sure. An ENT is, you know, best thing is his little toolkit. So ultimately we all have these little spray cabinets and we carry Afrin, you know, neosynephrine, other things like that. So in the office we can decongest a patient very well, give them an immediate sense of relief. It also allows us to help them drain a lot better too. A lot of patients with sinus disease will complain of ear pressure. That congestion in the ear is very similar to when you come down from an airplane.
Okay. And
we have devices in the office that can, quote, pop open the ears for them and give them an immediate sense of relief too.
And then are there any medications that you prescribe? Are there antibiotics?
Sure. So from a medical standpoint, we'll always start off with the hallmark of antibiotics. We use penicillin traditionally if the patient's not allergic. And we'll also give a steroid injection. A steroid injection, steroids again, by definition, are anti-inflammatory.
Okay.
And sinus disease is inflammatory, so it helps the symptoms.
And so with sinusitis, with chronic sinusitis, when is it the best time to have surgery?
So that's a great
Because I know
question.
that's the last resort,
It is.
right? Okay.
Oftentimes doctors will refer patients to us because medical management hasn't worked. Allergists will refer patients to us because, again, medical management just hasn't worked. Or patients themselves will come see us because they're just fed up with all the infections. At that point, what we'll do is we'll then entertain the option of surgery. There's always three options for a patient. One is you can do nothing, medication, or surgery. And if the first two have been exhausted, then we discuss surgery in the setting of recurrent disease or chronic disease.
Okay, well, that was a lot of great information, and you know, now we're going to talk about snoring. But before we go in depth with the snoring and sleep apnea, do people who suffer with sinusitis typically develop or will develop some sleep disorders? I would imagine they can't breathe very well.
It's a very connected environment, the
Okay.
airway, from an ENT standpoint. So they can, when a patient has sinusitis or nasal congestion, they can't breathe well through their nose, and the nose is the natural route of airflow. And as a result of that, they'll rely on open mouth breathing, and that can contribute to impaired sleep, of course, loud snoring, and subsequent sleep disorders.
Okay, well, I have some questions that came through from Facebook, so I want to make sure I take care of these people. One of them wrote in, I suffer from frequent sinus infection and I use nasal spray almost daily. Is it dangerous to do this repetitively?
So that's a great question. So we'll take it a step further. It really depends on the type of nasal spray. Saline sprays over the counter are very benign. You can do them every single day. It's just salt water.
Okay.
Afrin, also over the counter, is extremely effective. However, we don't recommend patients use it for more than 3 days because that can become very addictive.
Okay.
What Afrin does very well is it shrinks the mucosa in the nose, giving you a great sense of relief. But the problem is after a period of time, they rebound and swell up again, and then patients become more and more dependent. It's very tough to get patients off Afrin, but we've done it successfully. The last one is a nasal steroid spray.
Okay.
Those are actually okay to use long-term as well. We have patients of ours with chronic sinus disease and nasal polyps, and we recommend they stay on it long-term. So to answer the question, it just depends on the type of nasal spray.
Okay, thank you, doctor. And then another question that came through is lifestyle. Does drinking alcohol have any effect on my sinuses?
Yeah, 100%. So a lot of times.
But we're in New Orleans, doctor. I mean, we drink a lot in this town, so I guess we have a lot of congested folks in our community.
And you should. Ultimately, it's nothing wrong with that at all. So wine is notorious for causing congestion.
Okay.
Definitely. So what we notice is that patients, when they have a couple of glasses of wine, will get a little nasal congestion. Again, what's happening is those turbinates are swelling up and becoming congested. This is a common thing we see across the spectrum. You know, There's irritative-induced rhinitis from things in the air. Pregnant women, for instance, in their 3rd trimester get a pregnancy-induced rhinitis. So lots of different things can, of course, cause congestion, but alcohol definitely can.
All right.
That's no reason to stop drinking, though.
What about vodka, doctor? Is that a little better?
I'll know tonight. I'll let you know.
Okay, very good. All right. We have a caller on the line. We have Pedro. Good evening, Pedro. How are you?
Good, Maria. How are you doing?
I'm doing fantastic. Thanks for calling. You have a question for Dr. Anand?
I sure do. Good evening, doctor.
Hey, how's it going?
Oh, pretty good, pretty good. I was diagnosed with hay fever a few years ago, and I utilized Allegra to treat it. And it worked for a long time, but as time's gone on, its effectiveness has gone down substantially. Is that something common that you see in your practice? And if so, are there other ways we can treat the hay fever?
Yeah, that's a great question. That can be, one of two things. One, the medication may not be as effective as you've kind of, suggested, or the actual disease process could be getting a little worse, and you might need a different type of medication. So we do see this from time to time. A lot of patients on antihistamines, there are different flavors of antihistamine, and some patients have a preference for a Zyrtec, for instance. Some patients have a preference for a Claritin. It all just depends, and it's all a process for finding the right medication. But in your case, if the Allegra isn't being as effective, you might want to try an alternative form of medication, or at least consult with your physician on what else to do and make sure the hay fever hasn't progressed.
Okay. Thank you for that call, Pedro. Doctor, in my case, I was on Flonase,
okay,
and
sure.
that worked really, really well because
Yeah.
I have allergies. And then I started using Dymista, which I thought was even better. And so for some, I couldn't do the Claritin and all those over the counter. I felt like it just gave me heart palpitations. Is this a normal reaction?
Yeah, it depends. So sometimes the antihistamines...
Just made me more hyper, guys. I don't need to be more hyper.
They can have a D. So sometimes there's Allegra D or Zyrtec D.
Okay,
those
what
are
does that mean?
decongestants.
Okay, right, decongestants.
And those can actually, of course, cause those symptoms too. They give
Okay.
you a great sense of relief, but again, too much reliance on them can be not the best.
All right, well, there you go, from the expert. All right, well, now we're going to get into snoring and sleep disorders.
Sure.
So I know that, like I said, we had a lot of action through social media when it comes to snoring, because I know many people who are in relationships who suffer with a spouse or a mate who snores. So I think we can get everybody some help tonight. Okay, so snoring, we all do it. We all do it sometime. Oh, we have a caller who came in. Hi, Jim. How are you? Do we have Jim on the line? Do we have Jim on the line? Oh, we lost Jim. He'll come back. Come back, Jim. All right. So when it comes to snoring, doctor, we all do it at one time or another. What happens physically to us that makes us snore?
So snoring, ultimately, simply put, it's a sound. That's basically what it is. And what's occurring is tissue in the back of your throat is moving. The most common source for a snore is your palate. If we've all opened our mouths and looked straight back, we can see our palate and that little uvula kind of hanging down like a dumbbell. That will vibrate, producing a sound. And that, in essence, is what a snore is.
Okay. And so demographic-wise, do men suffer from snoring more than women?
Men tend to suffer from snoring more than women. And
Why
actually,
is that?
as we age, too, of course, they tend to have more redundant tissue. So the tissue in the back of the male throat, for instance, can be, of course, much more vibrant and much more flexible, causing the sound. Even as we age, too, we notice that the elderly population will snore a lot more than, of course, the younger population. And it makes sense, too, because as we age, our tissue becomes far looser. And so, of course, it's much easier for it to actually move at night when you sleep, causing that snore as well.
All right. We have a caller. We have Mike on the line. Do we have Mike?
Yeah, I was calling. My question is, I've had a sinus infection for about 2 weeks, and will that just go away on its own, or do I need to go see a doctor and it's going to get worse?
Have you tried any medications for it, Mike?
Yeah, I've tried some decongestants.
Okay. Well, it seems like you've made an attempt to do conservative therapy with over-the-counter measures. But if it's been 2 weeks now and your symptoms are consistent with the sinus infection as we discussed, I think at this point you should definitely seek, additional help. I think an antibiotic and a steroid shot would not be out of the equation for you, and it could definitely get you some relief. Definitely. I would seek some further care.
Okay. sinus is obviously something that a lot of us suffer with as well. Okay, so back to the snoring. So basically, doctor, you're saying that as we age, the older we get, the more, I guess, prone we are to start snoring?
Sure, the more tissue becomes lax, it becomes more pliable.
Okay.
So that's one of the reasons why. Of course, it can affect us at any age, and at any one point in time, we all do snore at a certain point. The question ultimately becomes, is the snoring representative of something more sinister underneath, like sleep apnea, or is it causing simple dysfunction in a relationship? We notice that quite a bit too.
All right, we have another caller waiting for you. We have Reggie. Good evening, Reggie. How are you?
Fine. I'm trying to find out. I want to ask this question. I mean, I've noticed every morning I wake up, I have dry mouth, I snore a lot. I've been diagnosed with sleep apnea. I'm trying to find out what is it can I do to get rid of this snoring problem.
All right, Reggie, you called the right place.
That's
Dr.
a great
Anand?
question, Reggie. So one of the more common complaints we hear of is a dry mouth when patients wake up. And what's occurring is, of course, they're breathing through their mouth. You and I can breathe through our nose all day, every day, and never dry out. Those turbinates humidify the air. We open our mouth for a few seconds and we get parched. In Reggie's case, if he's been diagnosed with sleep apnea with a sleep study, there's always a couple of treatment options. One thing, of course, you can do is CPAP. That's the most tried and true treatment modality for sleep apnea. It's a pneumatic stent. It's a mask you wear, and it allows pressure to prop open your airway at multiple sites. This prevents the apneas occurring in obstructive sleep apnea.
Okay, well, we're going to have some slides and a lot more information coming up, Reggie, on the various treatment options for sleep apnea that Dr. Anand offers. We'll definitely go into detail. Okay, so snoring, is it dangerous, doctor?
Yeah, snoring can be dangerous if, of course, it's representative of sleep apnea. That's definitely the key, because ultimately what it can cause is impaired sleep. You become much more tired throughout the day. Sleep apnea by itself, when it's untreated, we're learning that's, of course, related to uncontrollable hypertension, cardiac disease, stroke, depression, motor vehicle accidents. Some patients will fall asleep at the wheel. So it can be very dangerous. All
right, we're going to get into more detail about that as well. We have Jim who's back. Hi, Jim. How are you?
Fine, thank you. Good evening.
Good evening. What is your question for Dr. Anand?
Yes, ma'am. I'm trying to find out. I had a complete rhinoplasty. And fine, thank you.
Go ahead. Go ahead.
Where is his office at?
You want to know where Dr. Anand's office is located?
That is correct.
Okay. Well, at the end of the show, we'll definitely give you that information.
We're in Metairie. We're in Metairie. We're not too far. So we're in Metairie and Chalmette.
Metairie and Chalmette, and he's right by one of the medical buildings at East Jefferson General Hospital. So we'll get you off the line, and someone will pick up the line and give you the address and his phone number as well. So thank you for calling in. I'm sure you'll be able to see Dr. Anand soon. All right, we're going to take a quick break and watch this video, Dr. Anand. I was pretty excited because Dr. Anand invited me into one of his surgeries last week, and I met a wonderful gentleman named Gene who told me his story about his issues with sleep disorders and how we met Dr. Anand. And now I want you to watch this video, and it'll just show you the life of a man who decided to undergo this treatment to make himself feel even better. And we'll see Dr. Anand in action. So let's take a look, and then we're going to come right back, and we have another patient of Dr. Anand's who's going to join us and talk more about sleep apnea. So are we ready for the video, gentlemen? All right, let's do it.
I walked into his office to make an appointment on a Monday morning. Making the appointment, he walks into the office and says, "Oh, you're making an appointment? So I can see you right now," which I thought was great. Dr. Anand saw me that same day, examined me, put a camera down my nostril, and discovered that I had a deviated septum on the right. So then we set me up for surgery, and he told me that also I had an uvula, whichever way you pronounce it, which was a little bit larger than it should be. So that's going to be taken care of, which will relieve the snoring. And hopefully, everything will be fine, and I think it will be.
You all ready for surgery today?
I'm ready for surgery. Call me Gene. I'm not
No problem, Gene. No problem at all. Well, I'm glad you came by today. Just to tell you guys a little bit, Gene's situation is very common for most patients with sleep apnea. He's tried CPAP, he's gave it a good shot, but unfortunately he just can't tolerate that machine. And as a result of that, he was seeking for a different option. When he came into the office to see us, his story is again fairly common. He mentioned intolerance of the apparatus, but in addition to that, during the day, breathing is very difficult for him. So that gives us a clue that something is going on 24/7 that's causing resistance to breathing, difficulty breathing. And as Gene mentioned very, very well to us, he just felt that he would get more labored throughout the day. What we did very simply in the office was place a camera through his nose, and we just examined his airway from nose to throat. And right away, we could immediately see that his nasal passage was blocked. Gene was only utilizing about 50% of his nasal airway. So right away, when he's doing things like exercising, activities such as that, he's not getting enough oxygen. In addition to that, we also noticed that his palate, where the uvula hangs in the middle of the throat, is very, very long. That structure rattles consistently, causing a loud noise that we all know as a snore. But also, when he sleeps, that tissue falls back and causes blockage in the throat. So we're going to actually take care of both of those. Today, improve his ability to breathe both day and night, but more importantly, to decrease the number of obstructions he has at night and to decrease his snoring, to give him an improved sense of breathing both day and night and bump up that energy too.
Good.
Good. Any questions before we proceed?
No, I'm fine.
Okay, I think you're going to do very, very well.
Good. Thank you so much.
It's good to see you.
Nice seeing you.
We specialize in multi-level airway surgery. That's what sets us apart from other people. We do everything at the same time under one operation. It's much easier for the patient, and then ultimately it provides a quicker result. A lot of patients that we see that'll come in for something as simple as snoring will ultimately find that they have lots of blockages in their airway, and unfortunately a lot of these patients have undiagnosed sleep apnea. We'll then of course counsel them and send them home with a sleep study. They come on back, and then if they have sleep apnea, we can then offer them certain procedures. The biggest thing for all these people, the common thread, is that there's trouble breathing. And during the daytime, it results in, of course, labored breath, difficulty moving air through your nose or your mouth. And at nighttime, that trouble breathing results in sleep apnea. What we ultimately try to do is find out why. There's always a why. And we can do that in the office with, a few minutes with a little camera and a scope. And then after doing so, we can provide the patient with, a definite understanding of why they have trouble breathing. And that's where we get most of the benefit. And more importantly, that's where most of the patients improve with regards to breathing. And it improves their outlook both day and night. I'm going to disconnect you real quick. And whenever you're doing airway surgery, it's really important to have good communication with your anesthesiologist and your anesthetist in the room, because ultimately, this is the patient's airway, so it's important to have that connection. Okay. And then this is the part of the procedure where we go ahead and actually inject the anesthetic. This again allows us to decrease any bleeding, but also to decrease the patient's discomfort after surgery. It's important to remember that Mr. Dubrock, when we talked to him earlier, he also mentioned that he had bypass surgery not too long ago. A lot of patients, when they have sleep apnea and it's not diagnosed, it can lead to heart disease, heart attacks. So a lot of times, long-term sleep apnea that's undiagnosed and even untreated can lead to situations such as that. It's also been affiliated with stroke, with memory loss, with depression. It just goes to show you how important a proper night of sleep is for our overall well-being. A lot of questions that we get in the office circulate around the age. Mr. Dubrock is 71 years old. So really when it comes to age of the patients, age isn't a barrier, it's really what you have, the anatomy. And he's got findings. One can make an argument to go ahead and not do a surgery in a 71-year-old with this kind of medical history, but he's very well taken care of. His cardiologist has cleared him. More importantly, this is going to give him a lot more breath. So during this part of the procedure, we're now looking straight into the back of his mouth. We can see where his tonsils used to be. A key finding is that he actually had a tonsillectomy done many years ago. So right away when you have that decreases the post-operative discomfort in the procedure. So we're going to really focus on his palate. And what I can see here is his uvula is extremely long. It descends below the tongue. And that's the structure we're going to focus on in addition to his palate. And as we begin, we make a cut. It's really in an arc. So when you look in the back of a patient's mouth, they have the uvula that hangs down in the middle. What we do is basically smooth that contour out. So it's a nice arc after surgery is done. A lot of patients ask us, what's the purpose of the uvula? One of the main functions of the uvula really is to seal off the back of the throat when you swallow so that you don't actually have secretions go through your nose. In addition to that, it also helps funnel secretions down from the nasal region to the back of the throat, and we silently swallow all those secretions. So the key is, when you take this structure, you got to know how much to take to still preserve a lot of those functions, and that's the most important part. Resecting too much of this tissue can cause problems down the road, and so that's an important understanding to have in mind. So now what we're going to continue to do is then go to the nose and straighten out his septum, stitch. And then after that's done, the procedure is over. It takes about, 35, 40 minutes total. And so we'll see him back in 1 week in the office. We take out the splints from the nose, and he breathes a whole lot better at that point. The results are fairly quick. We'll appreciate results in about 3 to 4, days, decrease in snoring and improving in breathing too.
So everyone, I actually spoke to Gene today myself just to check in on him, and he seems to be doing well, and we'll definitely, Gene, if you're watching, you're definitely going to be a guest on the show when you're ready. So we'd like to continue and share your story and your experience with Dr. Anand. Okay, so Dr. Anand, in Gene's case, just kind of give us a recap on what we've just seen, and I know that you saw him in your office today as well.
That's correct. So Gene ultimately was a patient, who was diagnosed with sleep apnea. He was provided CPAP to use as a therapy, but he just couldn't tolerate it. And that's something we see all the time. In fact, about 30 to 40% of patients just won't tolerate it. The question that gets overlooked every time is why? Why can't he tolerate it? We saw him in the office, we did a focused history, but we did an airway examination.
Okay.
That should happen with every patient. And we were able to determine that Gene had natural anatomic obstructions that were preventing CPAP from working effectively, and were also contributing to his impaired ability to breathe, both day and night.
All right. And Doctor, I've learned today just through social media and the questions that come in, we have a lot of younger people who are suffering with snoring or snoring that leads to sleep apnea. Is that something that you see more of in your office?
Most definitely. So most physicians are very primed to assessing for sleep disturbance, and we're seeing a younger subset of patient, and they'll be diagnosed with sleep apnea, or there's a suspicion of it, and they come to us always and they say, I don't want to wear a machine for the rest of my life. It's a natural trepidation to have at such a young age, and that's when it's important to examine their airway.
Absolutely. Well, we've had 2 women who have been extremely patient waiting to talk to you, Dr. Anand. We have Elizabeth on the line. Good evening. How are you?
I'm fine, thank you. I phoned to ask about my mom is 82 years of age. She had Dopplers done, and there's no occlusion in the Dopplers, but she suffers from chronic sinusitis and also has had a lot of dizziness recently. And I wondered if there could be a correlation between the sinusitis and the dizziness.
Yeah, sometimes when you get a head cold, for instance, to use, a lay term, patients can feel a little lethargic and they can feel a little lightheaded at times. Sometimes, if you want to really get down to it, what can happen is the middle ear space is connected to the back of the nose via a structure called the eustachian tube. Whenever we come down from an airplane and we pop our ears, it's because we're inflating the ear space through that tube. In some patients with chronic sinus disease, they can build up fluid in that middle ear space, and that can contribute to sensations of dizziness or imbalance as well.
Okay, thank you for that call. I know that everybody's wondering who this fine gentleman is, seated next to Dr. Anand. And everyone, this is actually a patient of Dr. Anand, Jarrett. And say hello, Jarrett.
Hello.
So we're going to continue talking about snoring and sleep apnea. I'd like us to learn a little bit more about it, and then Jarrett is going to tell us about his story and his experiences, and how you feel today after your procedure with Dr. Anand. Sounds good?
Sounds great.
All right, so you just sit tight for a few more minutes. Okay, so Dr. Anand, now let's get into sleep apnea. You've mentioned it a few times, and obviously people are calling in talking about it. So what exactly is it? And if we have a graphic, let's put it up so we can learn more about it.
Sure. So sleep apnea is a general term for obstructive sleep apnea hypopnea syndrome. What happens is it's multi-level airway collapse during sleep. There's an apnea, which is a complete cessation of breathing for 10 seconds. So if you and I held our breath for 10 seconds, that's exactly what it is. There's also a lesser known hypopnea. Hypopnea is you're still breathing, but the level is so shallow, you're not getting enough oxygen in, and your blood oxygen level can fall. Those two things, when they happen at night, and they're beyond a certain threshold, that's what a diagnosis of obstructive sleep apnea hypopnea syndrome comes in, more commonly known as sleep apnea or OSA.
Okay, thank you, doctor. We have another call for
Sure.
you. We have Martha on the line. Good evening. How are you?
I'm fine, thank you.
You have a question for Dr. Anand?
Hi.
Absolutely. I've been diagnosed with sleep apnea, and it's untreated. I've not use the CPAP or anything. And so I'm wondering if rather than using the machine, I went with tonsillectomy and adenoidectomy, if that would actually improve the apnea and give me better rest.
So that's an excellent question. So ultimately, you're a patient who was diagnosed with sleep apnea, and the question is, where do we go from here? I highly recommend every patient that's had a diagnosis to get a proper airway exam. What you can accomplish with that is we'll know where your source of blockage is. Now, in many cases, we can treat it. In some cases, we can't, but you will be armed with that information of what you can do. To answer your question specifically, if you have large obstructing tonsils or large adenoid tissue, then by removing that tissue, your breathing will improve automatically both day and night. And should you decide to use CPAP if you need it, that air will, of course, flow with less restriction through your airway. So it's a great question.
Thank you so much for that call. And in her case, I know that in Jean's case as well, he had a tonsillectomy, correct?
No, Jean did not have a tonsillectomy.
Oh, he did not have a tonsil. Okay.
Not at all.
Okay.
So that's a great question. So Jean had a septoplasty, a turbinate reduction, and a uvulectomy.
Okay, we're going to get into all those.
No
so it seems like it's a lot, but he made it look really easy in surgery, Dr. Anand. And how long was that the total surgery?
It took us about 35, 40 minutes. Not very long.
Not very long and very effective. Okay, so when someone is, usually I think, because I know my uncle suffered with sleep apnea, and I remember as a child sleeping over at his house, and you would hear that gasping, and then they'd wake themselves up with the, with the snoring, but it seems to always be the spouse who's the first one to notice that it's a problem, So how is that typically how patients come to see you, is because their spouse has been complaining about the snoring or maybe the fear of some sleep apnea?
Yep, that's definitely, it always starts with a snoring, and then they'll get a little more serious and say, I have to wake him or her up at night. It feels like they're choking. And the patients will describe it that way too. They feel as if they're choking in the middle of the night. And that's an active obstruction occurring and your body trying to wake itself up and get proper air into your system.
Okay, we have another caller. We have Joe on the line. Good evening, Joe.
Yeah, good evening. I got a question for the doc. I have a niece, she was born with that. She's been on a ventilator since she was like 5 or 6 years old. Okay. And basically they could not figure out everybody thought it was sleep apnea, but there's something else wrong in a part of the brain. Have you figured that out, if there's any cure for that or not?
In these younger patients that have symptoms consistent with what you're describing, there's an entity called central sleep apnea. So that's a great point and a great segue. In central sleep apnea, the impetus to breathe cuts off from the brain. In obstructive sleep apnea, the impetus to breathe is still being sent from the brain, but the tissues are obstructing, blocking it. So a lot of times in these patients with central sleep apnea, the neonatologists who treat these young kids will give caffeine at times and other medications, but we don't see that in our practice. We treat mainly obstructive sleep apnea, but hopefully that information will give you something to go on.
All right. Thank you so much for your call, Joe. We appreciate it. Okay, so you talked about your in-office procedure or diagnosis. So again, you have a spouse or a man or a woman who's obviously not feeling very well. Yeah. And again, let's just recap the symptoms. They seem to be very tired.
Exactly.
Right?
There's an excessive level of daytime fatigue, and then how do we get to that? There's a
So
questionnaire.
you wake up just feeling exhausted.
You wake
like
up
you slept,
feeling...
but you really don't feel like you've slept.
Bingo.
Is that it?
That's it.
All right. I know Jared's shaking his head, so.
When you wake up from sleep, you should feel refreshed. But ultimately, some of these patients, a lot of them will wake up feeling tired. Okay. And that's the first clue that something isn't right. Number two, they just feel tired more and more throughout the day when before they didn't.
Okay.
Those are hallmark signs.
Okay, so they come to see you, and then there's an exam. You give them a full exam in your office?
Exactly. We do a full airway exam, and
full
this is
airway
the key.
Exam. Okay.
We'll do a clinical assessment to see their risk, but every single patient that comes through, we place a camera in their nose, and we look at the back of the nose and the throat and even in the voice box. And we can see beyond a doubt where their likely source of obstruction is, and then we can tailor a treatment plan according to that unique anatomy.
Okay, and we're going to talk about the treatment plans after we take this call. We have Dennis on the line. How are you?
Hey, thank you for taking my call.
Hey, Dennis.
Hey, my question is, do you need to have a sleep apnea study before you would go in to see you for your procedure? I can pretty much confirm that I have it, and I'm wondering, should I bother with that or just come in and let you look at it?
Yeah, that's great. So ultimately the answer to that is no, you do not need a sleep study. Now, of course, we determine if we have a high suspicion and you have unique anatomic findings that we can correct, we label that sleep disordered breathing without a sleep study. We can still treat that, with procedures.
And doctor, I know that you're one of the only physicians in the area. You actually do a home sleep study with some of your patients?
Yeah, that's right.
Can you tell me a little bit about that?
So
and especially for this gentleman would like to know?
That's great. So in our office, we actually dispense home sleep studies. So for the right type of patient that meets certain criteria, we'll send them home. It's a headband. They wear it around their head in the comfort of their own bed, and they turn it back to us the next day. And it actually tells us, what the level of sleep apnea is. It assesses the oxygen level too. And for patients that, meet a select criteria, they don't have to spend the night in a lab. So it's very convenient for a subset of patients.
Because typically I would think people who have to go sleep in a lab are not going to sleep comfortably anyway. People sleep better in their own beds, doctor.
Yeah, they definitely do. And one of the more common complaints that we get for patients that go to in-lab studies is that they always say, it's not my bed, somebody's watching me.
Right.
It feels a little different. So it's good that we can catch them in their natural environment.
Okay. So doctor, I want to talk to Jared, your patient here. Jared, nice to meet you, first of all.
Yes, nice to meet you.
Okay, when Dr. Anand told me he had a patient who would like to be a guest on the show and tell his story, I expected an older gentleman, and then here walks in Jared, fine, stocky, healthy-looking guy. Yeah. Jared told me he's not a bodybuilder, not a power lifter, he's a power
builder.
A power build. Okay. So, tell me your story. So how were you feeling and why did you call Dr. Anand?
Well, for years, I would say it probably started later in high school. I started noticing snoring, but I think it got worse as time went. When I started gaining more weight, I played football for a little while in college, had to put on some weight. I got bigger, muscle bigger, and I had a girlfriend that obviously noticed me stop breathing in my sleep and woke me up one time and told me you're not breathing. So I was like, that's probably nothing. And this just more and more happened as time went on. And I figured, why not get this checked out? Because it started getting really bad to the point where, with powerlifting and bodybuilding, working out, you bulk up in certain seasons, and I would get to a certain weight and get very large.
So did it become worse as you gained the weight?
Yeah, it definitely did. But I definitely found that, myself waking up my own self in a sweat or breathing very, very heavy and my heart racing. And I said, okay, I got to go get checked up. And looked into it, and I got strep throat a lot too. I had, a lot of tonsil infections growing up since I was a kid, so that could have contributed to it.
Sure.
So I decided to go in and talk to Dr. Anand. And he checked me out. He found my nose. I had to get a rhinoplasty as well because my left side of my nose, I had injured myself in football from a football injury, breaking my nose, and I never got it fixed, thinking it was only a bruise.
Sure.
So he fixed that and checked out my tonsils and uvula, and they're very big, very large for most people. So he took care of me, and boop, I was good in a week and a half time.
Do you still have the same girlfriend?
Yes, I do.
Okay, is she happy?
Oh yeah, she's very happy.
It's a great question. I had to ask. So.
Oh yeah, she's very happy. She was actually a patient of his not too long ago.
Yeah. Well, you keep it all in the family.
Yeah.
I love this. Okay, so now I want to hear his side of the story. Right. So give us specifics, Dr. Anand, and what you saw in Jared as a patient and your treatment course of action for him.
So Jared's situation is very common. Again, he represents a younger subset of patients who are being diagnosed with sleep apnea, and then they're faced with this machine. And it's the best thing out there, but unfortunately, if you're not tolerating it, the question becomes again, why?
Okay, so Jared did use the CPAP?
Yeah, I did a sleep study. Yeah, he told me, go do a sleep study. Did a sleep study, did the CPAP. It worked for a little bit. I tried it for about 2 weeks. I just could not.
Can we just show everybody a picture of the CPAP? For those of you, no one wants to sleep with one of these.
No.
And especially a young man like you.
And I got lucky. I actually got to use one that was covering just my nose.
Okay.
And that reduced a little bit of
so
tension
definitely it affects lifestyle.
It does affect lifestyle. It enters the bedroom. It can affect lots of things. But in his case, it makes sense. There was a proper hindrance to the transmission of airflow for CPAP. He couldn't tolerate it. A lot of patients are claustrophobic. They just feel suffocated.
Sure.
And then when we took a look at him in the office, it all made perfect sense. He had a football injury. He had a significantly deviated septum causing resistance to airflow in the nose. In addition, he had a very long palate, the long uvula, again causing the snore and blockage. And of course, he had very, very large tonsils. He did, of course, mention that he had lots of tonsil infections. So putting all this together, we found obvious blockages in his airway contributing to, of course, his breathing difficulty both day and night. And he was a great candidate for the procedure, and he's done phenomenally. In his words, he said it's day and night, in a sense.
So you feel great?
Oh, definitely.
And you have a lot of energy?
Oh, every day I wake up, whoa, I'm not worried about, I'm not tired fighting to get out of bed.
Right.
You know, I get enough sleep, even if it's 6 hours of sleep, because I worked late one night. I still wake up refreshed because I'm getting enough, you know, sleep.
Absolutely, absolutely. And so, doctor, I know that you have, in Jared's case, he had surgery, but you also have some in-office treatment that can work, like oral appliances. Why don't you walk us through that?
So there's other in-office treatments.
Because not everybody needs to have surgery,
no,
right?
Not everybody
you go
needs to
see
have
Dr.
surgery at all.
Anand first, and then he tells you what you need to do.
Exactly.
So, okay.
So from an in-office standpoint, what you can do is we can actually do radiofrequency ablations. You know, I'll show you a little probe right here. This is a probe that we use, and we conduct radiofrequency energy through this probe. And actually, we can insert it into tissue, for instance, in the nose, in the palate, and actually at the base of your tongue. This allows us to actually heat that tissue and then, of course, reduce the size of the tissue. And so it's an in-office treatment. It doesn't require any of the discomfort that surgery has. And again, it's for select patients.
And no downtime.
There's no downtime. It's just like going to the dentist. You walk in and you walk out. One of the biggest hindrances with sleep apnea surgery is the post-op discomfort.
Okay.
You know, what we do with this too is we're actually taking patients' tonsils and we're reducing them in the office with this. So that's a game changer. You know, tonsillectomies have been performed for the past 50 to 60 years in a certain fashion. And for tonsils that are large and not nearly infected, we'll actually insert this probe into the tonsil at 4 or 5 points and shrink that tissue. And it's just a whole different world for most people. They don't have to endure the discomfort. They get it on a Friday, they're eating a steak dinner on Saturday or Sunday night. So.
Wow. Don't we love technology and
Technology
and medical advancements for sure. Okay, and so when someone comes to your office, they can do an in-office procedure like this.
Exactly.
But then, obviously, if someone is not a candidate for this, they can then the next course of action is the different types of surgical.
Exactly.
So let's talk about the different types of surgeries that you offer for sleep apnea.
So the different type of surgeries focus around the different parts of the airway. There's nasal surgeries, which can of course include, like he had, a septoplasty and a turbinate reduction, where we open up the nose, so to speak. They can also include what we call.
What are we seeing there?
This is great. So what you're seeing here on the left-hand side, it's the turbinate on the left, and it's actually decongested. That's the structure that congests for most people when they have a cold, a stuffy nose. On the right-hand side, on the top right, you can actually see in that left nasal passage a piece of the septum sticking into the nose. We, of course, corrected that, and now that patient has an open airway on both sides, allowing a significant improvement in nasal breathing. When we walk a little lower down to the back of the throat, the surgeries can be a tonsillectomy, a uvulopallar pharyngoplasty. There's other procedures called a lateral pharyngoplasty, all centered at opening up the back of the throat. That's very important. We can walk a step further into the base of the tongue region, and we can do procedures. Of course, we can do procedures with the probe that, of course, are very targeted. And even we can walk further into a patient's voice box and, of course, do procedures called a hyoid myotomy and suspension. They're a bit more advanced, but the ultimate point is there's lots of things that we can offer, all tailored to a patient's unique anatomy.
Okay, and are there, I mean, like any surgery, there's some risks or complications that can occur, but I know, you know, based on the research I've done, doctor, that the recovery is how long's the recovery for this type of surgery?
That's great. So it really depends on what you do. So if we add a tonsillectomy to the mix, you know, of course that procedure can delay the recovery by about a week and a half, and it's, you know, a bad sore throat. You know, Jared had one too, and he said a week and a half was kind of his downtime.
Okay, that's not so bad.
It's not so bad at all. The best thing is you're improving throughout that period as well.
Sure. Okay. All right. And so I know that I have this gentleman emailed me, and so I want to make sure we ask his question. He has sleep apnea, but he was told, this is his question: years ago I had a consult with an ENT who told me I wasn't a candidate for sleep apnea surgery due to my recessed chin.
Sure. Okay.
So he says, have any other procedures been developed to help me? Please help.
We definitely have procedures for that.
Because he's looked into it and was not able, was very discouraged because he felt like he was going to be on a CPAP for the rest of his life.
So it ultimately depends on the comfort level of the surgeon that you're working with. So the tongue muscles insert into the mandible. Of course, the chin is the forward portion of the mandible. If your chin is recessed and it falls back, naturally the tongue will fall back too. So those patients have a very high degree of retrolingual or tongue base obstruction when they lay down. There's obviously a way to fix that. What we do is we can actually advance the jaw forward. It's a more advanced sleep apnea procedure. It's reconstructive, but it'll also be slightly aesthetic because it'll bring the natural plane of his chin in line.
Okay, and I know that we've seen oral appliances, and I think they even sell some over the counter at Walgreens or CVS, and I just happened to skim one a couple of days ago. But tell me your thoughts on that. Do oral appliances work?
Yes,
for
oral
some
appliances
patients?
do work. Oral appliances are a great first-line option for mild to moderate sleep apnea.
Okay.
Now your sleep
How does it
study,
work?
What they do is the oral appliance is fashioned by a dentist who specializes in sleep medicine or sleep dentistry, and they actually take an impression and they slowly advance the jaw forward. As we just mentioned, the tongue musculature inserts in the jaw, and by inserting that and moving it forward, you're going to pull the tongue forward. It is a mouthpiece. You do have to wear it at night. So a lot of patients, when they can't tolerate CPAP, they also say naturally, I'm not going to tolerate something in the mouth. But it is good first-line therapy for mild to moderate sleep apnea. It definitely is.
All right, and again, I think the best course of action is to obviously visit with an ENT for proper diagnosis.
Exactly.
Because I'm thinking, in my uncle's case, he died of a heart attack in his sleep. But we hear a lot that somebody died in their sleep.
Yeah.
I used to hear that a lot for these Italians. I know my parents' age group. They always think people just die in their sleep. But when my uncle just died in his sleep of a heart attack, I actually thought to myself, it must have been the sleep apnea, because his snoring was so bad and he would just gasp for air all night. Is it a possibility? And what are the risks of sleep apnea going untreated? What are the long-term effects?
Sure.
Because I want people to listen to this.
It's important. So let's talk about what happens when you actually sleep. When we sleep, we enter a resting phase. Our blood pressure drops. And then, of course, when a patient is struggling to breathe, they, of course, spike up. They spike awake. Their blood pressure shoots up. This occurring multiple times per night over, years, decades, can, of course, cause hypertension, cardiac disease, and, of course, cause the very feared, dying in your sleep, so to speak.
Right.
And then for patients that have untreated sleep apnea, undiagnosed sleep apnea, they have the risk of falling asleep while they're driving, They have, of course, the risk of depression. There's other mood disorders, stroke. We're knowing that hearing loss these days is affiliated with sleep apnea. If you think about it, we spend a third of our life in sleep. It's important for that to be effective.
Absolutely. We only have a few minutes left. So, Jared, the fact that we have a lot of people watching this show tonight, and when you were going through this experience with the snoring, you first thought, it's nothing, and you really didn't take charge of your health, as we say on this show. So for viewers, what advice can you give them? If there is a guy out there or a woman who's watching the show tonight and says, I've been snoring a lot too, and
I would say at least go and get a consultation with a doctor, get it checked out. It's an issue, and I got to a point where I kind of got scared, because I'm 30 years old and I want a lot of life ahead of me.
Absolutely, you want a long, healthy life, and you want to feel good and be active.
Be active, and I'm athletic as it is every day, and I want to stay that way. And being tired definitely got in the way.
Being tired was not your recipe.
Right.
That's not something you wanted.
I didn't like during the day sitting down at my desk if I was doing some paperwork, all of a sudden start falling asleep out of nowhere.
Wow. Okay.
So get it checked out. That's my biggest advice.
Get it checked out. Doctor, any words of advice, or if anybody's watching the show tonight, and a lot of people, I know they're a little shy to call, that's why they emailed or sent me a message via Facebook. So Doctor, anything you can tell us tonight about, again, patients who might have questions or just coming to see you?
Yeah, no, we're always available. We believe in getting patients in quickly because, of course, that's what you need, a quick assessment and a quick diagnosis, and accurate nonetheless. So they're always welcome to come by and talk to us, and we're very informative and we're very nice. We smile a lot.
I know, they do smile a lot. I've been to Dr. Anand's office, and you're a wonderful, wonderful guy. He's got a great staff, and all of your patients that I've met have been wonderful as well. And so, Jared, I just want to thank you for being here tonight. It was very brave of you to share your story, and you know, just keep living life to its fullest, right?
That's right.
And then we'll get your girlfriend on another time, talk about what she had done. But that's another show. That's another show.
Right.
Dr. Anand, thank you so much for being here. We now know you definitely are an expert when it comes to snoring and sinus disorders. You know, you've developed a practice solely around that focus. But everyone, Dr. Anand is also an ENT who covers a great range of medical services. So you can just check him out yourself. All right. So if you want to contact Dr. Anand's office, please call 504-309-8615, or you can visit his website. It has a lot of great information. It is GNOsnoring.com. I'm Maria Muro, and I want to thank you for tuning in to Doctors New Orleans. Remember, if it's about health, we cover it, and we loved hearing from you. You can reach out directly to me via email at info@doctorsneworleanstv.com. Thank you for your calls tonight. We hope you found the show informative, educational, and inspirational. Stay healthy and have a good night. Take care. Thanks.
Doctors New Orleans is underwritten by Acadian Ambulance Service and New Orleans Living Magazine.
I'm self-employed with a small business. I've got a handful of employees, and part of my incentive package for them with their salary is that I cover their health insurance. I came across Blue Cross Blue Shield 15 years ago, and I've been with them ever since. Blue Cross has made a difference in my life and my employees' life by giving us the security of knowing that Blue Cross Blue Shield will stand behind us, whether something planned or something urgent. We have Blue Cross Blue Shield to back us up. That gives us peace of mind.